This is an audiovisual representation of a study published in the Journal of Bone and Joint Surgery in 2020. Traditional growing rods are a surgical strategy used to treat early-onset scoliosis, a progressive condition occurring in patients less than 10 years of age. Final fusion is generally regarded as the endpoint of this high-risk procedure, but some patients may still require an unplanned reoperation after final fusion. Despite these reoperation rates being high, there have been no studies assessing associated risk factors. The present study set out to identify risk factors associated with the need for reoperation after final fusion following treatment of early-onset scoliosis using traditional growing rods. A multi-center database for patients with early-onset scoliosis was retrospectively analyzed. Factors such as spinal deformity characteristics, complications, and comorbidities were compared between patients who required reoperation after final fusion and those who did not. 32 of the 167 patients required reoperation following final fusion. Surgical site infection and anchor site failure were found to be the most frequent complications requiring reoperation. Patients with curve progression who needed revision surgery during lengthening with traditional growing rods were found to have a significantly increased risk for reoperation after final fusion. Similarly, the number of vertebral levels spanned by the traditional growing rods and the duration of treatment were also found to be associated with increased risk of reoperation. Thus, the present study identified curve progression requiring reoperation during lengthening with traditional growing rods, an increasing higher number of levels spanned by the rods, and longer duration of treatment as independent risk factors for reoperation following final fusion in patients with early-onset scoliosis. These findings can guide physicians when counseling patients and can also guide surgical decision-making.